Thank you everyone for joining us. We'll get started in about 1 minute. Good afternoon, everyone. My name is Jennifer McDuffie, and I'm the Associate Vice Chancellor of Health and Wellness Services here at CU Boulder. I'll be moderating today's call. Some quick housekeeping items before we get started. All attendee lines will be muted throughout the call. When we get to question answer, please place your question at the bottom of the chat Q&A function at the bottom of your screen. We'll do our best to get to all questions. If we don't get to your question, please know you can reach us directly at colorado.edu/COVID-19 on our website. And as a reminder, today's call will be recorded and available on that site post this webinar. On today's call, we have joining us Dan Jones, our Associate Vice Chancellor of Integrity, Safety, and Compliance, Catherine Eggert, Senior Vice Provost and Associate Vice Chancellor for Academic Planning and Assessment, Jeff Zayak, Executive Director with Boulder County Public Health. Additionally, we have our panelists with us, Catherine Irwin, our Chief Human Resources Officer, Carla Hoa, our CU Boulder Chief Financial Officer, Shannon Alaba, our Communications Manager with the City of Boulder, and Dr. Chris Urbina, the Medical Officer with Boulder County Public Health. At this time, I'm going to turn it over to Dan Jones.
Thank you, Jennifer, and welcome everyone. As many of you know, last week, Boulder County shifted to level orange, safer at home on Colorado's COVID dial framework. This change made by the Colorado Department of Public Health and Environment did not in itself require our campus to change plans for fall instruction. However, given the increase in cases, to give our students maximum flexibility to travel home before fall break, if they choose to, our campus will shift to fully remote learning mode beginning Monday, November 16th, and through the end of the semester. My colleague, Catherine Eggert, will provide additional details regarding the rest of the fall semester in a moment. COVID conditions have increased across the state. Boulder County has some of the lowest infection rates in the Denver metropolitan area, but they are still too high. Friday was the first day in the last month for Boulder County where factors on the COVID dial hit the level red. This is going to be much harder to address than the previous spike in infections because the increase is not concentrated in one age group or one locality. It's affecting all populations. It is much more diffusely spread. Our own dashboard shows a spike in cases in the double digits starting last week with a monitoring positivity rate of just under 2.5%. Isolation spaces at this time, this morning, were at 7% utilization. As Jeff Zayak with Boulder County Public Health can explain later, our uptick in the following surge is really following increases across all age groups in the county in recent weeks. We at CU know what we can do to help, and we know what was needed. Everyone has COVID fatigue, I know, but the rise in cases across the county and the state is really related to people letting their own guard down, not wearing masks, not social distancing, and gathering in groups outside their household. Please help us to keep the rates of infection down. We need everyone to get tested now. We have built one of the strongest testing capabilities in the county, and we urge anyone with a Buff 1 card to take advantage of it. As we approach the end of in-person learning this semester, getting tested before leaving Boulder is crucial to helping prevent the spread of the virus to other communities, to other travelers, and your family members. To support those who do decide to return home, we are providing expanded on-campus testing starting this week. All residence hall students are required to continue their weekly monitoring testing and should specifically aim to complete a monitoring test 48 to 72 hours before departing Boulder. Off-campus students are strongly encouraged to get testing at any one of our on-campus monitoring testing sites, again, 48 to 72 hours before leaving. You can visit colorado.edu/COVID-19 for location information. All staff who are required to participate in monitoring testing should continue to test weekly. And all other faculty and staff are strongly encouraged to get tested if they are planning to travel over the next several weeks. Campus guidance, again, is to get tested 48 to 72 hours before leaving Boulder. I am grateful to our students and parents for their adaptability and perseverance. I'm also grateful to our faculty and staff for the dedication they've shown in serving our students. I want our parents to know, I know that these are difficult decisions to make, and we're trying to make them with our students' best interest and their health and safety as our #1 priority. Now I'll turn this over to Senior Vice Provost Catherine Eggert.
Thank you, Dan, and thank you everyone for joining us today. I want to echo what Dan said about these being difficult decisions to make, and also that I too appreciate everyone taking time to stay informed. So in deciding to shift to remote learning starting November 16th, we wanted to provide instructors and students with ample time to prepare. The last day for in-person instruction this semester will be Friday, November 13th. If they choose, students may remain on campus through November 25th. We will keep residence halls, apartments, and dining locations open with the current safety protocols in place, including the continued requirement to participate in weekly virus monitoring appointments. We'll also continue to provide isolation spaces and support for those who test positive for COVID-19. In short, we're continuing to prioritize our students' academic, physical, and mental health needs. Last week, Provost Moore sent messages to our instructional faculty, asking them to communicate with their students and to provide specific information and guidance on how this shift will affect their courses. Provost Moore also asked faculty to work directly with their deans and divisional deans on programs and courses that are asking for optional exceptions with some form of in-person instruction from November 16th through November 25th. So examples of these exceptions might include performance classes, lab sessions, studio work, and courses taught in the residence halls as part of the first-year academic experience. What's important to know is that attending these instruction sessions that are in person during November 16th to 25th is optional. If students travel home during this time and can't participate in person, they won't be penalized. We've also encouraged our instructional faculty to visit the Center for Teaching and Learning and the Office of Information and Technology for any assistance needed with remote instruction. I think we've made great progress on this area since last spring, and I really appreciate the spirit of engagement and support with which our faculty have approached teaching this semester. With this move to remote, research and research-related activities are not impacted at this point. So No requests are necessary related to previous return to research approvals. While, as Dan mentioned, the current surge of COVID-19 infections in the Denver metro area is concerning, and while it will require a community-wide effort to bend the curve back down, this shift to remote learning for the rest of fall does not impact our previously announced plans for a hybrid in-person experience in the spring semester. Yesterday, November 9th, student registration for spring classes began. We're offering for spring a full suite of in-person classes, remote classes, and classes that are a hybrid of in-person and remote. In fact, we're planning to offer more in-person classes in the spring than we have this fall semester. We're confident that our facilities preparations have made our classrooms safe places for teaching and learning. No transmission of the virus has been traced to our classrooms, and we're hearing that same result from our peer universities that have taken the same precautions that we have for classroom space. I want to extend my sincere thanks to our students who've worked so hard to make the best of a difficult semester. And I also want to thank our faculty and staff who have worked tirelessly to serve them and to help them have a productive academic experience at CU Boulder. I'll turn it over now to Jeff Sayak with Boulder County Public Health. Jeff?
Thank you so much, Catherine, and thanks everyone for being on the call again today. I am going to focus, I'm not going to show slides today, but I do want to talk about our extremely increasing and very alarming rates that we have at this point. Dan already touched on some of that, so I want to focus a little bit on what that looks like, and then I want to talk more specifically about the impacts. And I'll try to address a few of the comments I've seen in the chat up to that point as well. So right now we are at a pretty serious and significant challenge. If any of you have followed that dial incidence rate on the statewide website, you've seen that state website turn from green and yellow and blue to mostly orange and red at this point. We have significantly alarming and very steep climbing rates across most all of those counties that are in red. Some of those counties are above 1,000 per 100, and we have to take this virus very seriously. We're also seeing skyrocketing hospitalizations at this point. We have higher hospitalizations in the state than we had during the entire previous time in this virus. That doesn't change for Boulder County. Boulder County has the highest rate of hospitalizations that we've had since the beginning of the virus as well. We've also had 14 deaths, and Chana can confirm this for me if I'm off track, but I believe we've had 14 deaths just in the last month alone. Those are people's mothers, fathers, grandfathers, sisters, but their loved relatives that have deceased from this disease in the last month. We're definitely at an alarming place, and people need to take it seriously. We were about several months ago, when we were in the lowest portion of the summer, we were about 1 in 800 people who were infected in our community. And several weeks ago, if we look back 4, 5, 6 weeks ago, we were in the 1 to 3 to 400 range of persons in our community who were infected. This week, at the start of the week, we were at 1 in 100. And it's probably even lower now based on looking at those incidence rates on the state website. So we're in a very difficult and challenging place in our state. Not one county can control this virus individually at this point. We need to be looking at statewide measures. We need to be looking at regional measures. We need to really be thinking about taking personal responsibility. We are in the stay-at-home level for incidence rate at this point, and we are required to submit a mitigation plan to the Colorado Department of Public Health and Environment, which we will do this week. And we are looking at, if this trajectory doesn't change, we're headed towards stay at home. And that's a significant challenge for us, because I just want to give a few examples. We met with our Chamber of Commerce this morning, And the personal and retail services and how they're going to be impacted in our community are severe. They talked about people crying, saying that they can't sustain any more cuts in their businesses or they will be out of business. We need to think about this not only from a save our business standpoint, which we know is going to have a severe and lasting impact on our businesses if we move forward into stay at home. And it is right now. We've already seen significant reductions in businesses' abilities to stay open and be able to survive, to be able to feed their own families. But we also need to save our most vulnerable. Again, 14 deaths in the last month. Those are things that we can prevent. And it comes down to our ability to take personal responsibility and action, and we have to act now. We can't wait any longer. Like I said last week, I'm just as tired of COVID as anybody on this call. I wish we were in a different place, and we're not. And until we get to a different place, the personal responsibility and acting and following the social distancing, not gathering. At this point, we really are asking people not to gather, with exception of anybody in your household that you live with. But unless we really follow some of those things and wear masks, which we know can be effective, it's going to be really difficult to control the spread of this disease. And I'm going to give you one more example. So we've been working with our businesses, and we plan to work with our businesses more. The vast majority of our businesses are doing everything they can to try to control the spread of the disease within those businesses. They are working to make sure that people wear masks. They're putting mask signs up. They are cleaning. They are trying to control the environment so the spread is minimized. But if people go home and they have large gatherings with multiple families, with the incidence of virus that I just talked about in our community, the chance of spreading that disease is significantly enhanced. And then they may be asymptomatic, going out to a business, going out and socializing in other places, and spread that disease even more. So it penalizes our society, it penalizes our most vulnerable, and it penalizes our businesses when we don't take personal responsibility. And now is the time more than ever to take action. We can do this together, but it's going to take all of us together to make a difference. And I want to just stop there and see if Chris Urbina, Dr. Urbina, has anything to add at this point to anything that I already mentioned here.
Jeff, thank you. And thank you for the CU community for allowing me to come and speak and add to what Jeff said. Jeff, I can't tell you how grateful I am for you to talk about the impacts of this disease. I think we're now suffering from number fatigue. And I think people have just basically turned off the dial and said, 10 million cases in the country. What does that mean? Or 250,000 deaths. I think you stated it very well. For every case, there's a loss of work. There's a lot of mental health challenges. Kids can't go to school. Businesses are losing income. And for every death and hospitalization, what we're seeing is people that are suffering from long-term sequelae of the disease. Even though the disease is mild, they may have chronic fatigue, they may have memory loss, they may have challenges with other organs like the heart, which are pretty vital. They recover, but they're not recovering as quickly as we had hoped for. Yes, the hospitalization is a significant factor, and people are staying in the hospital a lot less because we have treatments. But I think as we approach, and I know there'll be questions about the vaccine, and I'll be happy to address that earlier. And until we get a very safe and effective vaccine, and even when we get the vaccine, we'll still have to do the mitigation strategies that you talked about, Jeff, that of physical distancing, of wearing a face covering, of washing your hands, of not going to school or work if you're ill, and avoiding social gatherings. I am very worried next week or the next couple of weeks as students go back home or bring it back potentially back to the university. And I'm very worried about social gatherings. My household has already curtailed our Thanksgiving plans, which is a big deal for us. So So I can't stress enough that we're now talking about the significant impacts of this disease, and numbers are important, but there are people that are suffering from this illness. So thanks, Jeff, for making a big point of talking about that.
Thanks. I think at this point, I'm turning it back over to Jennifer.
Thank you, everyone. Before we turn it over and open it to Q&A, I just want to echo what we heard from Dan, from Catherine, from Dr. Urbina, and from Jeff. It is so important that our students, our faculty, and our staff, we remain vigilant. We keep up physical distancing. We also know that we have to finish this semester strong. As the number of COVID cases continue to increase around the country, our students' anxiety and stress are also increasing. Counseling and Psychiatric Services, lovingly referred to as CAPS on campus, has a series of free workshops to help students cope with COVID-related changes in their lives or other changes or thoughts that may be happening related to the pandemic. They're a great option for students who want something short, skill-based, and really are in that feeling of distress. We also have a lot of opportunities for drop-in appointments through our Office of Victim Assistance, our Counseling and Psychiatric Services, and we also have Faculty and Staff Assistance Program for our faculty and staff here at CU. Whether students choose to remain on campus in Boulder or return home, the Division of Student Affairs is here to support them. There are many opportunities and resources available, so please visit our website, which is linked off the COVID website, for virtual programming, ways to connect, and ways to really make sure that they're taking their health and wellness seriously. One of the things that we have is students visiting a fall events webpage. They're great for taking a break, whether that's a break from studies, a break from working, a break from social media. It's a great way to meet people, to manage stress, and to learn something new. You'll find both in-person and virtual events that include practicing mindfulness, crafting and painting, and one was just announced today with a very up-and-coming rapper who will be leading that, activities at the rec center, and much more. We know that this semester has been stressful. We also know that returning home or concluding could also increase levels of stress and anxiety. Sometimes it's helpful to talk that through. There's no problem too big or too small. Please drop in, whether it's to CAPS or through Let's Talk, which are free and open for students throughout the week. Finally, the lead up to finals. It's really important that our students finish strong, whether you're struggling for motivation or it's a concept that you can't quite master or a paper that needs a little bit more thoughtfulness or a second set of eyes to review. We want to make sure that you know you are not alone. Our academic advisors, our academic tutors, we are here to support you. Now is the time to ask for help, whether it's going to your professor's office hours or forming a virtual study group with classmates. We're here to help you finish strong. Thank you for all that you're doing to support yourselves and to support the community. We're here to support you and you're not alone. So at this time, we would like to open it up for question and answer. If you have a question, please feel free to enter it in the Q&A function at the bottom of your screen. We are prioritizing questions that come from students and family members first. All right, let's get started here. This first question is for Dan Jones and possibly me. What COVID-19 testing result documentation is provided to the student and when prior to them departing for home for Thanksgiving holiday?
So presently, if you take your monitoring test, you will get within 24 hours an email with a referral. If individuals need specific, and that message will give you additional details, but if individuals need a specific piece of documentation, that they need to provide, whether because of the state they're traveling to or because the airline requires that. That's something that the students can go to Wardenburg or the public health clinic. Jennifer, you probably have more to add to that.
I would just like to add, thank you, Dan. I think you did a great job. Students who visit the public health clinic or Wardenburg are able to get documentation of a positive diagnostic test. And most healthcare providers in the community can also provide that should you ask. For Jeff, this next question, given the statewide spike in positive cases, has Denver International Airport implemented any additional measures or restrictions that you know of?
They have not at this point, and I'm just want to confirm that and make sure that Chana, who's our public information officer, as well as Chris, are not aware of anything, but I am not aware of any restrictions on travel at this point.
I do not believe so. They have testing at the airport, though.
I just want to add, I just was looking up that question and looking at the DIA website, and there are some restrictions regarding parking. Obviously, everybody's required to wear a mask. There are some concessions that are closed. So I think it's probably going to take a little more time to get through the airport. So I would refer everybody to the DIA website to make sure they at least know the rules and whether or not there's delays in timing, et cetera. So.
Very good points. For Dan and Catherine Eggert, so maybe we'll start with Dan. This is a two-part question. Other large universities around the country are following more freedom or allowing more freedom than CU as far as in-person classes, events, etc. Can you speak to what other universities are doing versus what CU is allowing, given the low transmission rates in Boulder County relative to the rest of the country?
Sounds good. I can start with that. I think one thing to know is that decisions for our classes and on-campus events are something that we make in conjunction with the guidance and partnership with Boulder County Public Health. We have been in communication with our colleagues and peers at other universities, the Pac-12 and the AAU. We know that the test, trace, isolate approach is something that has worked. We've seen that, in fact, in our last spikes, and so that's something that we know works and helps protect the community. We also know, and this is probably something that Catherine and I will talk more about, is that we're learning from this semester, and we'll be providing more in-person opportunities and more opportunities for students in terms of their overall engagement.
Yeah, I'll just echo what Dan said, that the fall semester has been instructive for all of us at any university. There's a huge range of response across large universities in the nation, and it depends a lot on their situation, whether they're urban or rural. It depends on their student body. For us, we have learned that we can offer classes in person. We can't offer all our classes in person because of social distancing. Our classrooms don't hold as many students as they used to, and so we have to accommodate that. And a lot of our students want to learn remotely or online for the spring. So we have made adjustments in terms of what students have told us they want and need. And we will continue to do that, including providing more appropriately socially distanced social activities for students.
Thank you. Now, the second part of this question, and Catherine, we may start with you, and then Dan, if you want to follow up. If the county goes to stay at home, what will happen with research labs and building access for research labs?
I can go ahead and
Thank you.
jump on that one. So part of the campus plans are, keeping within the requirements that we have with the state, the current state stay-at-home order, is that, we will need to restrict activity down to critical staff and critical research. We are working on guidance that will be out shortly, just to provide the campus and remind the campus what those definitions are, so that folks can plan accordingly.
And I'll add to that is that we're fully aware that not only faculty and research personnel participate in research, but also graduate students. And we're taking that into account with plans for research if there's a stay-at-home order.
Thank you both. For Jeff, my son who lives off campus made an appointment for testing at the Stasio site last week. When he went for his 9:30 appointment, he said there were at least 40 to 50 cars ahead of him. Is this common? And what advice do you have for him or others trying to get tested?
I'm actually going to ask Chana Gassetti, our Public Information Officer, to see if she can answer that.
Hi there. It isn't common to have 40 or 50 cars in line. I don't recall the day that you said you went. I guess I don't really have any great advice other than to leave enough time because there may be cars in front of you. Go ahead and pre-register so that once you're there, it's really fast moving. But we don't have a way to know whether it will be busy or not. So the best advice is to give yourself enough time.
Jana, do you want to mention that it's actually not appointment based? You can just go at any time and they don't actually do appointments?
Right. Yeah, you can, it is good to register online, but it's really, you can go anytime you want, even if you don't register online.
Thank you for that. And I think it's important to note for students, it sounds like the student is a student at CU Boulder. We are open for surveillance or monitoring testing Monday through Friday, and we have options throughout campus. In fact, the next question leads into a little bit of this. Where on the COVID-19 updates website is the testing information available for students as well as faculty and staff? So you can find all of the testing information, including locations, times, on the Protect Our Herd site. And we can place the URL, I believe, in the chat. And so I believe it's colorado.edu/monitoring, but we will triple confirm that and put that in the chat. This next question is another two-part question. So we'll start with Dan and Chana. Maybe this is one for you as well. So here's the two parts. Where can faculty and staff get tested? And where can dependents without a Buff 1 card get tested?
So presently, faculty and staff can get tested at any of the monitoring sites on campus, and the site that hopefully will be in the chat here shortly, where you can find those locations as long as you have your Buff 1 card. In terms of dependents, presently, dependents cannot get tested there. And that's where I think we're encouraging you to use your provider or the sites that the county and city have set up. Chana, do you have anything to add to that?
Yeah, so there's two free sites in Boulder County, one Stasio Ball Field and one at the Boulder County Fairgrounds in Longmont. And then on our website, we do have a list of all of the testing sites, whether they're paid or not, whether they're rapid or not, on our website. And that's boco.org/COVID-19 testing. And I did include that in the chat for folks. Thanks.
Thank you. So the next question is for Jeff and possibly Dan. How are you weighing different COVID metrics as to their relevance to the CU community? More specifically, while the positive cases have gone up, deaths are way down.
I'm happy to jump in and start that. So as I had just mentioned in the beginning, and I think this is really well illustrated again on that COVID-19 website at the state level where the dial is, our incidence rates are almost as high now as they were when we were at the height of the outbreak with CU. And if you look at the metro regional data, the spike in those counties, so I'm talking specifically about Adams, Denver County, Arapahoe, and Jefferson, their spikes are more than 2 times, in some cases, higher than the highest point of the spike with the CU surge. So we're in a really bad place. We're in a place that's tough. It's really difficult to control the spread when it looks like that. And as I noted, our deaths are up. We have had 14 deaths in the last month. That's more deaths than we had in the last 3 months across this. And so we are definitely in a place where our hospitals are up. We know it's impacting people from the age group of 30 up. So when you look at our hospitalization specifically, you can see that people 30 years and older are getting hospitalized. So it's not just our oldest folks. It is happening to those age groups that we don't always hear about. So we know there's a major challenge. We have people who have died, and it's very sad because, like I said, those are people's parents, grandparents, and loved ones. So all of us taking personal responsibility is really, really important. So as it relates to CU specifically, we want CU's been a huge partner with us in this. We need our students to continue to be diligent about this, but this is a community-wide issue at this point where it's going to take all of us together to make a difference.
And a few points just to add to that. It's important to know, there's a lag into these different factors. And so, cases are increasing, that eventually can lead to increased hospitalization. And that's where we as a community need to do our part to help prevent that. I would also refer to Dr. Urbina's comments earlier that, there's still a lot that we don't understand in terms of the long-term impacts of COVID-19. The last thing I'll just mention is that we are working to align the dial, align our own planning with the dial. Feel that's an important way to make sure that we can provide predictability for students, parents, faculty, and staff. So just that doesn't mean we're getting rid of what's on the dashboard, but just know that our actions will be more aligned with the dial that's used by the state and the county.
Thank you. So the next question, Jeff, along the lines of hospitalization, this is a two-part question. What is the typical hospitalization rate in Boulder for this time of year? How far above normal are we?
Thank you for the question. I don't actually have the rate answer for you. I can try to find that out. I can tell you that our hospitalization rate, when we were looking at it in the summer, was much lower than the metro region and much lower than the state's hospitalization rate. And I know that's increasing. There is a metro site that I can plug the link into the chat on, that you can look at actually the metro area hospitalizations. And it's based on a 7-day moving average of new hospitalizations per day. And you can look at what our rate looks like comparative to, or the new hospitalizations look like comparative to the rest of the metro region. So we are about in the middle when you look at the region. We are higher than Broomfield and higher than Douglas, but we're lower than the rest of the counties that are out there. That being said, the highest number of hospitalizations that we had in this disease outbreak was 68 people in the hospital in one day. We are now at 89. So we're higher than we ever have been before. Our curve is continually increasing with our rates. And until we get to a place where we can stop the rate of that increase, we anticipate that we'll continue to see increasing hospitalizations. And unfortunately, we're going to continue to see increasing deaths.
Dr. Urbino?
Jeff, if I can add a few things to that, I think what people don't see behind the scenes is this. Many of the hospitals in the Denver metro area and all across the Colorado have cut back many of their hospital services. elective surgeries, procedures, things that have been the lifeblood for our communities to address issues like colon cancer, heart disease, procedures, surgeries like knee surgeries, things like that. They've had to cut those back because of the overwhelming impact of COVID-19 hospitalizations. And now what we're seeing is stresses in the hospitals, and Jeff can attest to this because he has conversations with our CEOs. The hospitals are now struggling to maintain their staffs because many of them have gone out infected or infectious, so we don't want them working in the hospital, or many have become quarantined. So they're now struggling to maintain the staffing, respiratory therapists, nurses, physicians. So it's not just an impact on the hospital numbers, but it's an impact on the entire hospital system and healthcare system. So that's when you talk about fatigue, COVID fatigue, you should be addressing the COVID fatigue of healthcare workers just as much as the fatigue of people that are getting tired of the policies and the mask wearing, because it's stressing that system. So hospitalizations is just one number. The rest of the issues behind the scenes are equally important.
Thank you so much for that. And if we could stay on that topic for one more question, actually it's a couple of questions, but I think it's one. Jeff, maybe Chana, do hospitalizations reported represent Boulder County residents in a hospital anywhere, or are they all people in Boulder County hospitals for COVID, or just Boulder County residents in Boulder County hospitals? So a little bit more detail about what that data is representing.
Chana, do you want to answer that?
Sure. The hospitalization numbers that Jeff is referring to are people who are hospitalized in Boulder County, but are not necessarily Boulder County residents.
Thank you. The next question is, I think I can answer. Is there any plan to extend weekend hours available for student testing? And we currently have weekend hours through the 21st on Saturdays from 9 to 1 in medical services. And we are evaluating capacity as well as needs to determine if we should extend it outside of that date of 11/21. For Dan, what other steps can be taken regarding the segment of the student population who are continuing to violate public health orders? Many of us on this call are the ones who've been vigilant, yet others continue to violate public health orders, and punishment doesn't seem to be stringent enough.
So that's a complex question. I think one of the things just to reinforce, and as you had put in your question, we know that the vast majority of students are doing the right thing, and we're grateful for that. We continue to explore with our partners with the city and the county different approaches that we can take to try to address problem areas. So there are additional, where there are problem houses that are off campus, then we will, we're working with them to put additional, stay-at-home orders in place. I know for many of the off-campus congregate, houses, they have been required to develop plans that have been reviewed by the county. And so we'll need to continue to take different approaches. We also will need to continue to look at how we can better incentivize behavior, as has been mentioned, in terms of looking for the spring, having additional activities that students can attend, and how can we make sure that involvement in that is tied to getting testing and following all of the expectations that we know people need to do. So it's a complex problem and not in one that I think everyone is struggling with, but we'll continue to try different approaches.
Thank you. For Dan and maybe Jeff, How will a county stay-at-home order impact residence halls for spring semester?
So it's something we're continuing to watch. I mean, I think it will depend on the timing. Certainly, we know that presently, we know what the requirements are when there is a stay-at-home order, in terms of people need to make sure that they practice, increase social distancing and make sure they're not gathering in groups. No, Jeff, do you have anything to add to that from your perspective?
Yeah, I think what I would do is ask Trina Rulin, who's our county attorney and on the phone, to answer that question. She's got definite experience with that.
So under the stay-at-home, which is actually now called the red level, I don't think we're calling it stay-at-home anymore. We're using colors. Post-secondary education must be remote. In terms of the residence halls, how that would affect it, the residence hall would be your residence, your room would be your residence. So under a stay-at-home order, that's how you would analyze who you can be with in terms of your household. And it would just be your roommate and yourself would be your household.
Thank you for that. For Dan, does the expanded testing on campus include PCR nasal swab testing?
So the expanded testing is still the existing drool. Sorry, not drool. I'm describing
Saliva.
what the process is, but the saliva-based test in terms of the actual monitoring, and then from there you would be referred to medical services or your current provider. I don't know, Jennifer, do you want to add anything to that in terms of the specific testing that you all are doing?
Yes, so I can add, and for all of you, if you are on this call or have a student who's at CU, please encourage them to participate in the saliva-based surveillance test. As Dan mentioned, it is really quick. It's less than 2 minutes. It's free. There's not a lot of wait. And it is a saliva-based test. And then the other piece, that if there is virus detected, or a student is symptomatic, or a faculty or staff member has been identified through contact tracing as a possible exposure, our public health clinic does do the nasal PCR as well as the antigen, and they have appointments available same day. You can sign up through MyCU Health, and we're able to get results within about 24 hours back to students, faculty, and staff. The next question is for Jeff or Dr. Urbina. How many amplification cycles are used in the PCR test for CU and Boulder County?
That's definitely for Chris.
This is a very interesting question. Thanks for the question. Because there was a major publication several weeks, almost a month ago, that talked about the oversensitivity of the PCR test, where the amplification, and they have to put this through a chemical process, sorry to get technical here, to amplify the amount of virus within the specimen. So the cycles were up to about 50 or 60 cycles. Standard now, and they've kind of adjusted this based on that feedback, is around 25 to 35, depending on the lab. Now that number is in the medium range. It's still sensitive to detect the virus itself, but the exact number is probably is going to be hard to find because they're constantly adjusting that. But we can find that out if you are really serious to know if it's 35 or 36, probably less important, but that it's sensitive enough, but not oversensitive like we found out early on. And the labs usually make that decision.
Thank you. For Jeff, how can Buff families who are not local help support the community businesses? Perhaps a gift guide of products or services available to purchase online?
I can't tell you how much I appreciate hearing that question. I did post on the answer to connect with Corinne Walda, who is with the Boulder Chamber, and Corinne actually links to the other chambers across our county. So you can ask directly. They would be happy to share how folks can help support our community. And I know that reach out to them directly, they will appreciate that greatly. So thank you for posting that question.
And if it's okay, I can add, we are privileged to work with a lot of students who receive care packages and other items. And so if you're on this call and thinking about supporting local businesses and want to send a surprise to your student or maybe a student's friend, please do so. It can definitely mean the world to them. So this next question is for Catherine. How did the cohort model play out this fall? Will it continue? It seems this could improve the ability for students to socialize without fear of getting in trouble or getting sick.
So the cohort model, to be quite frank, was a mixed success this fall. It worked well in some of the residential halls that are very focused on a particular program. So engineering, for example, or business. Other cohorts were harder to form because in residence halls where students are, for example, in the College of Arts and Sciences, they have so many different classes and they aren't moving in cohorts from place to place as much. What we're doing for the spring is still in progress, but we are trying to reinforce the cohorts a little bit more, and specifically by creating more in-person dining that will allow students to dine together in a cohort by their floor or similar smaller pods of students. So that's a little bit vague. We'll have more information on that as the plans continue.
This next question is for Dan, and I can jump in if you need help. I don't think you will. Should a COVID-19 vaccine become available, will CU mandate that students, staff, and faculty receive it?
So actually, I'm probably just going to turn that question back over to you.
Yeah.
So
Right now, there's a lot of unknowns with the mandate, and it's something that we are looking at. One is when the vaccine would be available, side effects, obviously there's the mass production piece, but we want to look at our state as well as local public health agencies, legislation, to really determine what is the best approach to take with this. Dr. Urbina, I see that you're still on. Is there anything you'd like to add?
Jennifer, I think this is a very tough question. And
It is.
I think that's why Dan punted it to you. I think the challenge with the vaccine is you're exactly right. There's a lot of unknowns. And unfortunately, the vaccine has become very politicized. And right around the election time, we all heard the announcement yesterday from Pfizer that talked about their highly effective rate. That data is still unpeer reviewed. So I think we have to wait a little bit longer to see if that's going to be as effective as it's going to be. That would be great if it's that 90% effective. Most likely, as they wait longer in the trial, that rate will probably go down because these are preliminary results. There are also other vaccine producers that are producing also lots of vaccine. So I think it depends on the safety, the effectiveness of the vaccines, as well as the availability. The federal government, local health departments, state health departments are all launching and putting together plans. So we'll be able to share more as those plans come about. But I think at this time, I would say probably no one is going to be required to get the vaccine. It'll still be voluntary across the board. And we hope that people will trust the vaccine as it comes out, but more we could probably have in the future meeting. We can talk more about a vaccine as more information comes about. But that's our current status, still unknowns, but sounds very promising.
Thank you. This next question is to clarify from an earlier question. So to clarify from earlier, most people need evidence of a negative test, not positive. Is there a plan to start notifying people in writing about their test results if they are negative for monitoring and or diagnostic testing? So yes, in terms of diagnostic testing, so testing that's done through a medical provider on campus, we have been notifying, no matter if it's a positive or negative, the results. Beginning this week, students will be notified about monitoring test results through email. In the past, we've only sent notifications if there was virus detected, and we will begin sending notifications that no virus was detected, that an inconclusive test result may be noted, or the test was unable to be processed. While they're very limited, we do think that that's really important to share. So please note that starting, I believe it's today, students, faculty, and staff, anyone who participates in the surveillance monitoring will be notified. We have currently in process any notifications if virus was detected, which will continue. For Dan, if a student tests positive before planned travel, what should they do?
Well, first off, follow the instructions that you'll receive. The student will want to work with medical services, and in all likelihood, think I need to isolate for the period of time that they're instructed to. Once you get that test, it's really your responsibility to help protect those around you, and that's the best way to do that. And Jennifer, you or Dr. Urbina have additional guidance?
I would say that we also have another question that's similar, that any student who tests positive and lives on campus here at CU will have facilities available to them to support them through isolation. Shelter, food, health was the question in the chat. And I think it's really important, and why we're encouraging anyone who's traveling to get tested prior to going, so that we're able to isolate and prevent this further spread. Dr. Urbina, did you want to add anything to that?
Yes, Dan, thanks, Jennifer. If they're positive, they need to be isolated for at least 10 days and be symptom-free, or decreasing symptoms and afebrile for 24 hours before they can travel at all. So I think it's going to be critical that, as your medical services, and we can certainly help at Boulder County Public Health to help with those, that educational warning, but their travel will be restricted. That doesn't mean they shouldn't get tested, because I do think that for fear of getting a positive test, because if you're positive, you do not want to affect your family going home. So I know that's a double-edged sword. I'm trying not to give you a mixed message. I want you to get tested, and if you're positive, isolate, so that we can keep the infection not only from your colleagues here in Boulder, but also to wherever you would want to go home. And I know that's a bummer, but we want to protect all of the communities around us.
Thank you for that. I believe we have time for one more question, so I'll turn it over to Jeff. Jeff, what is the target positivity rate? Is it 5%, or has that target changed?
So there's multiple targets, and I'm going to go first back to the order that the specific order that was for the 18 to 22 year olds. I'm not sure where that 2.5% came from, but in our order, we had a baseline at 5% for both baseline and level A. And once we were at 10% or above, we were at level B, 15% at level C. The dial also has, so the state dial also has different levels as well that apply, and I don't have those right in front of me, and I don't want to take up too much time, but people can go on the state website and look up the dial and look at the actual percentage positivity for each of those categories, from green all the way over to red.
Thank you. So I want to make sure that we end on time. It is 1 o'clock, and we just want to say thank you so much for calling in today. If you have any further questions, please visit colorado.edu/COVID-19. We provide twice a week updates at 10 a.m. on Thursdays, and then with the city and county on Tuesdays at noon. Please also note you can give us feedback on this site. There's a chat at the bottom, a who to contact, as well as an ask a question. We'll end the call now, and thank you so much for joining.